Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today I wanted to give more information about CPMA certification and how I passed CPMA. What are the resources that helped me for a CPMA exam, and the other thing, the more information that I am going to give in today's video. So please watch video till the end and subscribe to my channel. And also, if any one of your friend is looking for CPMA guidance, you can share this video, which it's going to be useful for them. And also, if you have asked me whether I'm taking CPMA classes or not, so as of now I have not yet started taking CPMA classes. I'm only conducting CPC classes. But I'll see if I have all the time requirements, and then I may have to start the CPMA classes also for affordable fee only. If anything like that, I'll let you all know. And since I am currently working as a provider educator with the US based companies, we have some kind of conflicts of interest, since I'm taking training outside, like on my own, and they are paying me well for hourly basis. They are telling me that you can work with us for full time and stop taking your own classes, because when you are in the speaker role, when the audience who are paying like our webinars tickets will be kind of somewhere between 250 USD to 300 USD per 60 minutes. So when auditor, what to say, like the speaker who is going to present the webinar is doing all these videos and taking training outside for less fees, means the audience will definitely feel something differently, right? So that they are telling us to stop doing. So I am still processing what to do, what not to do, whether shall I join with them full time since they are giving me a good pay, or balancing both. So this kind of things are going on. So that's why I'm not doing a lot of videos like before. I hope you people can understand, because when you are actually working, your colleagues will be watching you online and you will be sharing certain information. So we have to be really careful on what I am going to post today. So everything matters. So since I am still working as a part-time, it is not a big issue. But if I join full-time, they have given me a strict thing that I have to stop taking classes also and doing all the things online, not posting related videos and all. They are not restricting, but classes training should not be there from my end. So that is what their rule is. So I'm still thinking, I don't know what will happen, so let it be. Other than that, let's talk about CPMA certification. So CPMA is Certified Professional Medical Auditor certification. If you want to grow in this medical coding and you have a career plans, like long-term career plan, means you can plan CPMA as your second certification, okay, for your own growth purpose. Because as an entry level coder, you will be having CPCA, and after CPCA, you know the process, right? You have to remove that apparentee status, then you will have the CPC credential, and after that you will be working. So say for example, you have worked for 1 or 2 years maybe, and you are a senior coder now you want to be in auditor position, okay, like quality analyst or the senior one, like into auditing, not the coding, okay. So that time the CPMA will be very much helpful for you. Just to stand out of the crowd, you should have the unique skills. So for that, if you can afford for another certification, definitely you can go with the CPMA. And mainly CPMA certification I would recommend for the people who are in profi coding and outpatient coding, Okay, for these people CPMA will have a huge scope, because you are going to learn a lot. Okay, it is having a broad subject, so you will able to understand so many things you're going to learn in this certification. And certification is also bit tough. Okay, so it's not that easy to just go and write exam and get passed. It's not like that. You have to put your efforts, and that is what I will tell you. And then coming to the fees, for 2 attempt it is 499 USD. And I have not taken any training for CPMA. Okay, because I checked CPMA training here in India, so it is costing around, they've asked few institutes I checked, it is somewhere between 25,000 to up to 50,000 they are charging for CPMA training. So I did not take the training. I, instead of taking the training, I took the AAPC study material, and I have studied that only. Okay, so I have studied, you can see I have a lot of study guides, AAPC study guides, AAPC mock papers, everything I have purchased, and I did study a lot. And then comes to just a minute. Yeah, so the exam pattern will be as usual. It's online practiced exam for Indian students. And like we will have books with us, whatever you opt. If you opt for ebook, they'll provide ebooks. If you opt for physical print copies, then you will have the print books. ICD, CPT and HCPCS, 3 books will be available on your desk. Okay, I opted ebook only because I am familiar with the ebook, so I did not face any difficulties in navigating course with the ebook. Okay, but if you want to go with the ebooks, definitely you should have a good hands-on the computer. If not, you feel very nervous at that time. And also it will take some time to load. Okay, so you should have you should, if you are not in a place that where you get panic, you can go with the ebooks. If you get seeing too many tabs on the exam, and you feel nervous, like if I press what will happen, that kind of mindset if you have, then definitely go with the physical copies only. Okay, then comes to the marks. Okay, it is again 100 questions, 100 multiple choice. You need to score 70 marks just like CPC. But coming to the subject, out of 100 you will be having the helpful resources with you, like it's an open book, right? But for 58 to, yeah, consider 58, okay, 55 to 58 marks, you will not have any resource with you. So whatever you have learned, it should be there here, that you will apply during your examination. Okay, because your books will not help you at that time, because your questions are from compliance and regulatory, medical record, and the other policies which is not there in our CPT or ICD book. Okay, ICD CPT book is useful only for the last section, which we have coding and reimbursement. There you will have the case studies for 36 marks case studies, and around 10 to 12 marks again you will be getting question related to coding guidelines, related to codes only. So you will be getting again around 42 marks you can get using your ICD, CPT and HCPCS book. Other than that, everything should be there in mind only, and we cannot carry any other resources. So we need to master the sections where we do not have any resource during exam time. Okay, that is the main thing. And who can who wants to do the CPMA, no? So preferably if you are already in auditing position, you may feel the subject is familiar for you. Okay, because when we talk about medical auditing and the auditing scopes, okay, like the auditing methods, you will be familiar with prospective audit, retrospective audit, focused audit, and baseline audit, numerical audit, statistical sampling, non-statistical sampling. All of these methods the auditors will already be aware. Okay, you just want to now understand what is the exact thing, why we have to do all this. Okay, for what purpose we are doing this, that you will be able to learn in depth. And so I will just walk you all through the marks distribution now. So then I'll just give you some info on that. Okay, so firstly, our CPMA breakdown. Okay, so CPMA I mentioned, right? CPMA again, Certified Professional Medical Auditor from AAPC only, and the certification is really having a good scope. So then firstly, first section we have for 17 marks, from medical record standards and documentation guideline. So medical record standards means we have a standard format of maintaining the medical record. Okay, for example, if you take evaluation and management, in the evaluation and management we follow generally SOAP format or cheddar format. So SOAP is nothing but subjective, objective, assessment and plan. So under subjective you will be seeing patient history and signs and symptoms, and then comes to objective, here you will be seeing the more details, physical examination and all. Then assessment, patient condition will be there, plan, what treatment provider is given will be documented. So this is the format of evaluation and management. And the optional method we have cheddar method, so that is again important. So then comes to if you are doing audit for surgery, under surgery the medical record will have a four sections, right? Header, indication of surgery, the body of the operative report, where you will be seeing the elaboration or the details about the procedure, and at last you will have a findings. Okay, so that is the four sections that you will be seeing in surgery operative report. So these are all the details you should know. You should know what exactly should be documented in the indication of surgery. So in the indication of surgery section, medical necessity will come. Okay, so we will have that brief info of the medical necessity will be there in the operative report. So this kind of things we will be learning, we will master it, not just what I'm saying. No, it is just very less thing. Okay, it's just a very brief info. And then signatures. Okay, in medical record, the CMS want what kind of signatures, whether they accept electronic signature, handwritten signature, or stamps, rubber stamps. Rubber stamps, we have some exception, like only the people or the physician who has physical disability, for them only rubber stamp is accepted. And then date and time, like after recording everything, once the medical record is ready, what is the provider duty? He needs to go through the record and he needs to sign the record saying that he acknowledged it. Okay, so that is one. And fraud and abuse, compliance plans, and in compliance plan we have 7 core elements to learn, everything we need to learn. And after that then we have around, covered entities. Okay, HIPAA covered entities, healthcare, health plans, healthcare providers, clearinghouses, HIPAA privacy and the release of information. So we already, for CPC you might be aware about HIPAA stands for, and what is PHI stands for, what is OIG stands for, what is NCCI stands for. So all of this for CPC we will have a basic knowledge, but for CPMA we will go in depth. Okay, we have to master every topic or every subject where you have some basic info in the CPC. Here you will have in-depth knowledge. Okay, so then record retention, like for every medical record which you handle in a, when you are a coder, you will be handling a lot of medical records, but you don't know what is the next process, how this medical records will be destroyed, or how many years there is a policy to retain them. Okay, so for example, if you are a patient, up to 6 years you can ask for your copy of your record from the HIPAA. So HIPAA should maintain 6 years of your medical record, and same way 5 years, and the people who are participating in COPs, condition of participation, they have to maintain up to 10 years. And for the minor patients like the babies, for their record should maintain up to 18 years. So we have a lot of things, that is what record retention, so we need to learn a lot of things on that also. And we have JOCO, so which is Joint Commission. So Joint Commission, it's an accreditation act. So under JOCO we have under JC, Joint Commission, we have things like prescriptions. Okay, prescriptions. If the doctor is prescribing some medication, he cannot just prescribe, and he cannot simply say you can take this tablet. Instead, the doctor should have that responsibility to educate the patient on that particular medication, what are the side effects of the medications, and some info on that medication the doctor has to give. That is the JC Act. And the JC also have abbreviations rules. Okay, so in the medical record you will be seeing provider will be documenting so many things in the abbreviations only. So sometime they'll document in a different way. Okay, so like for example, for international unit, the doctor might have documented IU, but the coder point of view, coder may perceive in the they misunderstand that IU to IV. Okay, intravenous. So likewise, some kind of abbreviations will always mislead the coders. So to avoid all those, JC will have a standard abbreviation list, so that we have to follow. And then legal requirements of medical records. So for some kind of legal issues, they may have to ask the patient medical record. Okay, so that there are some requirements we have to follow, the HIPAA rules. We will have a minimum necessary policies to give, that we need to follow. Then comes to compliance and regulatory, which will be, we will have 21 questions. Again, this 21 question, it is very difficult to get out here. Not out, you can't get, I think, some 18, 19. Why? Because you will be aware of the concept, but the options they'll give, those are very tricky questions. Like you cannot choose option A or option B, because whatever the info it is there in option A also, option B also, but with slight modification. So with that slight modification, that is like, it's a big deal. Okay, to choose between what is right. Like what I'm saying is, you will be aware of the concept, but you will struggle to choose the right option. We will struggle to understand their point of view, like how they are questioning, on what basis they are asking. Okay, so you will struggle a lot in that part. And fraud and abuse. Okay, so the CMS definition for fraud, CMS definition of abuse. Fraud is an intentional deception. Abuse is like unintentionally, unnecessarily costing patient, which is indirectly or directly affecting the CMS reimbursement. Civil monetary penalty laws. So here we will have a penalty laws for whenever physician makes fraud and commits for any kind of malpractice, then he may have to pay 3 times of the overpayment. And also per each claim we will have 10 to 11,000 fine, 10 to 11,000 USD fine. So that and all we have to learn. And Federal False Claim Act, Stark Law. Stark Law is nothing but physician self-referral. And types of audit. Okay, as I already said, we have a lot of types. And OIG regulations and work plan, NCCI edits, CMS guidelines, OIG imposed SIA. So here also OIG we have to master. Okay, in-depth knowledge we need on OIG, like why OIG will do, and what are the OIG, like since we have this OIG RAT stats, okay, statistical sampling software, how to utilize that, what is the benefits of that, everything we need to learn. Then comes to a recovery audit. Okay, RAC, recovery audit contractor. So under RAC also we will have lot to learn. Then Then comes to coding and reimbursement for 13 marks. So here you will be using your books, like here they will question on NCCI edits, CMUE edits, LCD policies, NCD policies, and they may also ask question based on coding guidelines. Okay, like the bundling, unbundling procedure, they may ask. So 13 marks here you can score really easy. In out of all this section, this is where I felt it is very easy for these 13 questions, which means 13 marks. Then we have scope and statistical sampling methodologies for 7 questions. Audit scope and statistical sampling. This is also easy. Audit scope is nothing but how to audit. As an auditor, if you are involved in auditing, you will already be aware. So whenever we take audit, we should have the objectives. Okay, auditing, what to say, this to construct the audit report, we should have certain stages. First will be background. Okay, under background, we will have all the objectives. We will find out what to audit, what kind of audit we need to do. Say for example, I want to audit ENM, evaluation and management. So for evaluation and management, what kind of audit I should do? Okay, I like based on if we find any errors in particular payer or particular level. Say for example, I want to audit only 99213, then I will do focus audit. Okay, so then what kind of sampling are needed for focused audit? Okay, and those are the first stages. Second stage will be discussion, not discussion, summary. Okay, like to identify the key errors. Then comes to discussion, then comes to standard of review, then comes to then comes to issue oriented findings. Okay, then comes to issue oriented findings. Lastly we have recommendations. Then lastly we need to attach the resources. Okay, for this audit, what and all resources I have referred and why this is an error. So this and all you need to include in the Excel form, and you need to submit to the provider. And after submission, like just imagine you have the patient claim number, patient name, what was the correct CPT, what is the wrong CPT they have coded, what is the rationale, what you are trying to say. Everything should be constructed and should be shared with the provider. For sharing with the provider also, we will have written written is like whatever you are doing, that will be considered as written documentation. Oral communication, after once you submit this audit report, provider may take some time to analyze what is wrong and where he needs to improve. If there is a deficiency in documentation, he will start improving that part. Then after that he will come back, okay, for to have a oral word with us. So that time, how auditor should communicate with the provider, how the provider should not feel bad. The auditor should be there in a level to make him understand what is wrong and what good things he is doing. Okay, we should always be like polite and respectful and unemotional, and what to say, we should not be in a place where we cry or something like that. So we have a rules, okay, to be a good auditor. Those are the rules we need to follow, and that is what comes in this 7 marks. Here also the questions will be little tricky, so if you understand all the concept, again you can. Quality assurance and risk analysis, so it is the same, we'll have little different things here. And then communication and the findings, like as I said, how you will communicate with the provider, for which purpose you have to communicate, everything we will learn here. Lastly, you have medical record auditing and abstractions, which is case studies. So here in the abstractions, you will already have the fee ticket. Okay, it's not like normal CPC case study. Instead, you will have the case study, and you may get some questions. You will have 2 questions. Some question you may have 3 questions. The fee ticket will be there. Okay, so fee ticket means what they have submitted. So in that, what is wrong you need to identify. ICD is wrong, CPT is wrong, place of service, or in that record provider did not sign. date of service showing wrong. So many key findings you will be able to find. So that is again very tricky. So you have to learn the subject, and as I said, out of 36, since you will have books with you, you can somehow get marks somewhere between 20 to 25. Okay, that is the maximum that you can get here, because not everything you cannot score whatever. Even if you are a pro coder, pro auditor, their point of view we cannot understand at that point, because you know that there is a place of service wrong, but in those option place of service itself not there. Okay, they are asking something else, so that you need to find out what is other than POS, what is there. Okay, so everything, it takes some time. So the out of 36, if you keep 25 marks, and remaining for 64 marks, here if you target around 60 marks, okay, you can easily pass. So what I recommend is, whenever you are preparing for CPMA certification, leave this portion, last 36 marks what we have, medical record obstruction and auditing, leave this part, because whatever you study, that will not get repeated. Okay, just understand the concept. So we have easy concepts only. Evaluation and management, you will get question on ENM, you will get question on surgery, some 2 questions from surgery will be getting, and physical therapy. Okay, physical therapy, you should know physical therapy timing rules, modalities, okay, long term goals, short term goals, and the certification, recertification related thing. Physical therapy is easy, so sometime I will make video on physical therapy also. So it is a big concept, but I will explain, I know physical therapy also. And radiology, psychiatry. So psychiatry, under psychiatry, psychotherapy plus ENM concept what we have, that they'll question. Then hematology and oncology, here they'll question more on chemotherapy. Okay, chemotherapy along with the IV push. Okay, some drug they'll use IV push, and for chemotherapy 96413, 415, and additionally for additional sequential R we have add-on code 417, right? So that we will be getting. Then infusion service, piggyback codes also you should have a good understanding. Hydration, IV push, and IVPB, all of these are important. Under surgery, you will be getting integumentary section, cardiovascular, and hernia related, I mean digestive, and also musculoskeletal. These are the 4 strong areas that you may get question here. So that's it. From all of these concepts, you will be getting 36 marks. So to pass certification, whatever the marks distribution is available here, okay, I will add marks distribution. Just master everything. Learn more about each concept that they have given here. Okay, because as I already said, for 58 marks, you will not have any resource with you. Okay, to cross verify or to cross check also, simply it says open book exam, but the open book exam is helping you only for, as I said, some 50%, that's it. Okay, not even 50, some 42 to 43 marks you will be getting using book, but other than that everything should be there in your mind. So it is very important, you should learn everything from here. Okay, so this section will make a decision about your pass or fail. So that's all. So I think I have discussed, I have took so much time to tell this. Just I wanted to give what will be there in the CPMA certification. So to coming to the conclusion, so yes, CPMA is a very good certification which have a good scope if you are aiming to get a remote jobs, like for example like me, if you want to work for some of the US based company and you have to work remotely, then they'll ask 2 certification, CPC and CPMA. That too, for if you are applying for auditor role, you should have CPMA. Okay, that if they are giving work from home means they want to analyze how much you are aware about the compliance. Okay, so what if you start doing your own training, like for me people will ask, why are you not taking evaluation and management training? Okay, I can start taking training, but there is a conflict of interest. They have had, like, they have trust, that's why they gave me work from home and I have a job. If I start doing all other malpractices like showing the chart and explaining what it is and doing all other things on my own, then they will not trust me anymore, right? So that's why I have respect for my job, and other than that, whatever I am doing from the long back, I am continuing to do that. Okay, as I informed the employers, they are okay as of now, because I am not the full-time employee. I am as a consultant, as a freelance person, so I do not have any issues. But if I decide to move as a full-time employee, then I have to get out of the training thing, and so I am still thinking what to do. So that's all. So if I start CPMA classes, I will post. If anyone is interested to take CPMA training with me, you can join my training sessions. Definitely I will make you get pass. I'll teach everything. Okay, so let's like as I said, I know where are the things I lost marks, and how to improve those skills for you. Everything I'll guide. Yeah, that's it, I think. And if you are preparing, or sorry, if you are planning to get CPC certified, or if you need CPC training, you can join my new batch starting from September 3rd. If you are interested, please do WhatsApp me, and I will not be answering through calls, okay, because it is associated with the Instagram and so many calls I'll be receiving, so I cannot speak to each and every call. I will also be working, so I have made this decision that if you're just WhatsApp me your message about your details, okay, so I can respond to that. So yeah, that's it guys. Thank you so much for watching this video. Please do subscribe to my channel, and please do share with someone who need this CPMA thing. And I forgot to tell, so to study this CPMA on your own, get the AAPC material only. Get the AAPC study guide, CPMA study guide, and yeah, CPMA study guide if you purchase, and if you master that CPMA study guide, there is a high chance that you can pass in the first attempt itself. Okay, so for any more information, you can connect with me. Thank you all.